interview is hot.
No single disease or condition that you cannot overcome with the right information. But stroke gives you up to at least 3 hours, but at least if you can get it within 1 hour, the doctor can be able to give your loved one a medication that is able to go and just break down that clot.
Welcome to today's episode, Daktari Explains. Here we keep it as basic as possible. I always say if you want the meats of some of the conditions we'll be tackling the in-depth knowledge of it, feel free to get the knowledge because it's there. It's available in all media platform, Google and all that. So the goal of this platform has always been to give you the knowledge that you need to apply in your life for the betterment of your health, and let doctors be doctors, those who are supposed to carry the weight of these conditions in terms of understanding. Before I go to today's topic, I have to say thank you to my 110 subscribers. I am so grateful that you found it important to subscribe and to view and even comment. I don't take that for granted, and I hope that this platform is adding value in your lives, in the lives of your loved ones as pertains health. So straight to today's discussion, we are looking at diabetes, a condition that in simple terms, it's when the body is not able to regulate sugar, sukari as we call it. So it's a group of metabolic diseases simply because that imbalance of sugar tends to affect so many organs, so many of our body functions, and that's why we call them metabolic diseases. Here today we are discussing the main or the common diabetes that we have in our setting, the type 1 and the type 2. Now, type 1 is what we call insulin dependent. So here you most often, if you have this condition or someone you know has this condition, you know that it started when they were children. So it affects you from a very tender age because it's where your body, what we call autoimmune, so your own body produces white cells, or the immune system decides to attack the pancreatic cells, we call them islet cells. So they are attacked by your own immune system, and now these cells, the islet, are supposed to produce insulin. So what happens when they are attacked? It means now they cannot function. That is producing the hormone. And insulin is actually the main hormone that facilitates us to get sugar into the cells. The other hormones, cortisol, adrenaline, they all function to remove sugars from cells, from the storage points into circulation. So you see, if you interfere with your insulin, then you've literally cut off supply of energy into cells and all the functions that are depending on it. So that is type 1. So we've said it's autoimmune destruction of the islet cells. So we call it insulin dependent because the only management for this is you'll have to be put on insulin because you don't have insulin. Then now to type 2. Type 2 is what now there's a lot of, it's gradual in onset, and it comes due to a sedentary lifestyle, no exercise, poor feeding habits, and then maybe there's a family or relative who had it, so you are predisposed, and now this insulin, now you have insulin in type 2, unlike type 1, but now your cells are not able to respond to the insulin. So that is why we call it insulin resistance diabetes or non-insulin dependent diabetes. And I've said now this one is in adults with age. That's when it starts to manifest. So you've eaten too much sugar along the way, you lived a very sedentary lifestyle, alcohol, smoking, all these factors now come into play. Now, risk factors, I've already alluded to them. I always say take note of risk factors because this is where you get to intervene for yourself at a personal level. This is where you get to do that which will stop you from getting the disease, and especially if you're predisposed, especially if you have a relative who has it. So, of course, that's our first risk factor, having a family history, especially first-degree relatives, siblings, parents, that kind. But even third degree, relatives is a risk factor. Then, of course, advancements in age, which I think I've already mentioned that. Poor lifestyle, poor feeding, poor diet. That should be the proper term. Lack of exercise, what we call now the sedentary lifestyle. Having conditions like dyslipidemias, that is, you have your body has an issue with regulating and balancing cholesterol in your body. So, of course, these are people who already, they're being managed from that point. So we call them dyslipidemias. What else? Conditions like hypertension, because these conditions give us what we call metabolic syndrome. I said diabetes is a metabolic disease. So the reason, what do I mean by that? They tend to come as a family. So having one, chances of you getting the other is very high. So that's why dyslipidemias here are coming in. Hypertension comes in. Women who have conditions like PCOS, polycystic ovarian syndrome or polycystic ovarian disease, they also tend to get diabetes. So these are the risk factors, and age from 50, 60 as you continue to advance in age. Had I mentioned obesity? Yes, it should be there in that list. So these risk factors allow you to know what you can do. So if you are in this category that I've mentioned, then it means you need to intervene, you need to change how you've been living so that you don't end up getting the condition. Now, how do we make a diagnosis of diabetes? And even before that, what are the symptoms then that if you see, then you really want to check your sugars? Either walk into a chemist or go to the hospital and have your sugars checked. Or there are people who have the glucometer and the strips at home, the small machine that we use, check your sugars. So we call them the 3 Ps before we get into the others. So polyuria, polydipsia, and polyphagia. Now, poly means a lot. Then now polyuria, so a lot of urine. Urea is urine. And why is that? Actually, history, just a little bit of history here. History, when this condition was coming, how do I say it? The discovery of this condition was, they used to call it sweet urine, because you have too much sugar that now the kidney has to flush it out or wash it out. So that sugar is in your urine. So they actually realized that's why it was called sweet urine. Let me not go much into the discovery and all that. So due to this sugar in the body, it has to be flushed out. So what happens when the urine is concentrated with a lot of sugar? It draws water, so it demands for more water to be flushed out from the body into the urine system to dilute that high concentration of the urine. So that, of course, results into large amounts of urine. That's polyuria. Now, if your body has to get a lot of water to go and dilute the urine, so what does that mean? It means the body will also demand from you to take in a lot of water. Now that is the other P called polydipsia. So you're sort of in a cycle. You have a lot of sugar that has to be flushed out, making the urine so concentrated. So more water has to be flushed out to dilute that sugar, and now that makes you have to take a lot of water. And especially at night, you just wake up to take water, take water. During the day, you're just taking a lot of water. So that's taking a lot of water, we call it polydipsia. Now the third P is polyphagia. Eating a lot, you're always hungry. Why is that so? Is insulin, we've said, is what allows us to, when we eat these sugars and these carbohydrates and what have you, insulin is what helps us to take in the energy inside the cells. It's what allows the cells to take in the sugar and convert it to energy and use its functions. So now your cells are not getting that. So they signal that we are not getting energy, we are not getting food. But the problem is, it's not that you didn't eat food, you actually have been eating food, but the food is not being received and used up as it's supposed to be. So that's another cycle. You're always hungry, you're always eating, trying to solve that deficiency that the body is saying there is, but again, this food is not being used up. So you're now in a cycle of taking too much water, going to the washrooms, a short call a lot, and now eating. So the 3 Ps. polyuria, polydipsia, and polyphagia. Then other conditions will be like blurring of vision, feeling fatigued, and such like are the other symptoms. So if you see any of these symptoms, and then in addition to you're in this category of risk factors, time to do something about it. It's time to go to the hospital. It's time to step into a chemist. It's time to take your glucometer and just check your sugars. Now, for the diagnosis to be made, there are certain tests we do in the hospitals. One, we call it the random blood sugar. So maybe you see these symptoms and decide, let me just walk into the hospital. We call it random because we really don't know when was the last time you ate a meal. So the assumption is you've eaten in the course of your activities. So a random blood sugar is just, you walk into the facility and they check your sugars. Anything above 11.1 millimoles per liter, that is considered diabetes. Now, what's the normal sugar? 4 to 6. Some school of thought put it at 3 to 6, but more often is 4 to 6. Now, there are people who you'll find they have 8, 9, 10. We call it pre-diabetes. So, of course, if you're pre-diabetes, you really need to be thorough on a lot of changes in your life. But now for you to actually be told you have this condition, it's anything above 11. Now, that's random. Then we have what we call fasting blood sugar. Now, your doctor or your healthcare provider will tell you to go home and fast for roughly 8 hours. Basically, is once you eat supper, don't take breakfast. Then now come in the morning and have your sugars checked just before you eat anything. So it's called the fasting blood sugar. Anything above 7 millimoles per liter, we now say you have diabetes. Then you have other tests like HbA1c. Mostly, especially people who already have the conditions, we use it to monitor how your body is responding to medications. So anything above 6.5, you're also having diabetes. HbA1c allows us to see the control of sugar in your body in a span of 3 months, because it's dependent on red blood cells which are destroyed every 3 months. Now, we are keeping it as basic as possible, so I'll not go deeper into that. Then you have other tests like oral glucose tolerant test, more tests that can be used, but I think those 3 should do for now. Other tests that must be done, of course, is like urinalysis. You know, you come to the hospitals and you're asked for specimen or sample of your urine. So a dipstick will be used. You want to see sugar. We said it's called sweet urine, the history of this condition. So we will be able to tell when there's a lot of sugar just by using the dipstick, the urinalysis that we do. We can even tell what it's called ketones. We'll get into that as we discuss more diabetes. We have got tests like BGA, that is arterial blood gases. Here we do it especially if you come and you're already having the complications, because there are people who the first time this condition the diagnosis was made for them was they presented with complications. So these symptoms either didn't present quite clear, or they were just thinking it's a condition and one disease or another. So the time the condition diagnosis is being made, they are already having a lot of complications. So that means we'll necessitate more tests. I hope up to there it's making sense, especially the symptoms, what we call symptomatology, how they come about, and the risk factors. Now, treatments on a very generalized scale is, of course, there is a lot of lifestyle modification for someone who has this condition. There is a lot of education that goes, what we call diabetic education. There are tests you'll be told to do it at least every year, like you have to see a ophthalmologist because of your eyes. You have to see a kidney expert, a nephrologist, because diabetes will go destroying all these organs. In the next video, we'll look at complications of diabetes, because that is where the crisis comes in. But generally, we've said lifestyle modification, and then medications. You probably know of metformin, glibenclamide. Now, yes, all these drugs, and now insulin, which is also very common and widely used. And a lot, yeah, I've said about the lifestyle modification. So That's it for this video. Take home message is please watch out for the symptoms, know when to intervene. You can live a very optimal life even with this condition. Well managed, if the diagnosis can be made early and the management taken up early, you will be able to run your activities as normal, or at the most optimal way that your life can function at. Mostly what we see is people coming with complications, like the diabetes foot that we'll talk about, and now these ones carry a lot of weight, because now you see amputations, people having to lose a limb. You don't have to wait for that, and that's the goal of this platform. Let's get education, let's come to awareness so that you can avoid some of these life-changing consequences of conditions that, if picked up early, the story would be different. So that's it from me here at Daktari Explains. I look forward to seeing you in our next video, where we will be discussing complications, as well as we look more into insulin, how to use insulin, how to store insulin, and everything as regards diabetes as far as we can go. It's such a wide topic, but we keep it as basic as possible. Thank you so much. Enjoy yourself. Remember to subscribe. Thank you.